Everyone, it's Maxine Szramka, the rheumatology doctor. Hope you're having an amazing day. Today we're going to talk about rheumatoid arthritis. What is it? It's one of the most common conditions that I and other rheumatologists see, and it's a condition that's actually synonymous with our name, rheumatologist. So when people come in and say they have arthritis, they often say, I have rheumatoid. And commonly people get confused between osteoarthritis and rheumatoid arthritis, and they're quite different conditions. Osteoarthritis is a condition where you get wear and tear of the bones, and the bones tend to be very hard to touch. Rheumatoid arthritis, on the other hand, is an immune inflammatory arthritis where the body's own immune system turns on itself and starts attacking the lining of the joints. When the lining of the joints become inflamed, which means there are more cells in there, there are more blood vessels in there, what that means is that more fluid is produced by the cells in the lining of the joint. The lining of the joint is called the synovium, and it's a very, very, very delicate lubricating material, and it produces a very, very fine small layer of fluid. And what this allows is the fluid movement of the joints. If you can just think of a machine, there's lubrication in joints in machine as well, except in the human body it's far more sophisticated and delicate. So when there's inflammation there and more cells, the lining of the joint produces more fluid than it would do already. Just imagine if you have something in your eye, it naturally starts to water. And likewise, the lining of the joints effectively starts to water. And it's the swelling of the lining of the joint as well as the excess fluid in the joint that causes the swelling and the pain and the heat in the joints. Rheumatoid arthritis usually affects joints in a very symmetrical fashion. So it can affect the large joints or the small joints or any combination of that. And it usually affects the same joints on each side. So for example, the right knee and the left knee are affected. The same fingers on the hands tend to be affected. So it looks like a regular pattern. And this helps to differentiate it from other types of arthritis where there's more of an asymmetrical pattern. That doesn't mean that if you have a few joints involved on different sides of the body that you don't have rheumatoid arthritis. It's just that a very typical pattern of rheumatoid arthritis is its symmetrical distribution. Rheumatoid arthritis affects people from any age, from children to the very, very elderly. The most common ages that I see in my practice are people between the age of 40 and 60, and increasingly as people get older. And it's interesting to note that it affects more women than men for reasons that we don't completely understand at the moment. So if you're diagnosed with arthritis, it's important to understand that it is not just a disease of the elderly. Osteoarthritis tends to be a disease that occurs as we age, as the body naturally wears and tears through use. However, immune inflammatory arthritis can occur at any age, so please don't feel like a failure if you're diagnosed with rheumatoid arthritis. It's nothing to be ashamed of, and it's no failure in life at all to be diagnosed with any condition at any age. It's just a fact of life. And the more we understand it, the more we understand how many people are affected by it, the more it helps us to accept that yes, people get these conditions at any age. And the good news is that with rheumatoid arthritis, we have fantastic treatments for it. That's enough from me for now. I'd love to speak to you more about the great treatments that we have for rheumatoid arthritis and the outcomes that I see in my patients with rheumatoid arthritis, but I'll do that in another podcast, and I look forward to seeing you then. Have an amazing day.